So touch-ups, revisions and complications in plastic surgery are just an inherent part of being a plastic surgeon. So basically when we do an operation, if it's well done, we do a careful design, we understand our patient, we know what we're doing, we've got our goals in mind. Then you're dealing with biology, and in the operating room we've got to draw lines on people and remove things and move things around, make things different. So the result depends on basically the surgeon's planning and quality, and the other thing it depends on is the patient's biology. So for example, skin is very variable stuff and not entirely predictable. So there's always a possibility after any procedure to need a touch-up, what I call a touch-up, a revision, or even a major revision. So a touch-up is where everything looks really good, the operation's worked out, we've got a happy patient and happy surgeon, healing's good, but there's some little imperfection, like a scar has stretched a bit, or the skin is loosened a bit in an isolated area and needs touching up. I would say 20% of my patients need some kind of little touch-up of that nature. You quite rarely, you see, if you look at a patient 6 months after you've operated on them, and you look at it, I could not improve that at all, impossible, that is perfect. How often do I see that? I don't see that often. And then, so if you see a little bit of an imperfection, you schedule a time, it's an office procedure, there's no cost to it, you plan out, you put a bit of local anaesthetic in, and you might touch up a scar or move something around a little bit. Typically, the scale of that operation is like taking a mole off someone. It's a local anaesthetic procedure, there's a nurse assisting, you can drive there, you can drive home, you're awake, there's no sedation, the stitches are usually buried and dissolving. And who wouldn't want to do that? I mean, the aim is to try and give you the best result that's possible. So I see touch-ups as not a negative, but a positive. We look at basically a sound and solid result and try and improve it.